There are usually four options when you have a missing tooth. The first option is to do nothing and accept the gap. This can be an aesthetic problem, it can restrict what you can eat and will increase the forces on the remaining teeth, as they will have more work to do when chewing. The second option is to replace the teeth with a removable denture. Now, although this is a less invasive tooth replacement option, it will affect your eating and speech due to the bulkiness and instability in the mouth. The denture must be taken out after eating to clean and overnight when asleep. The third option is the bridge, which is a fixed option in the mouth, but it is fixed to the adjacent teeth. This can often mean grinding down these teeth in order to attach the prosthetic tooth, which is damaging to the supporting teeth and can lead to problems in the long term. The fourth option is the dental implants. Now, this is a fixed option that is independent from the adjacent teeth. It comes through the gum, very much like a natural tooth. This is a gold standard tooth replacement option, and if planned well and executed well, it can give you the longest lasting and potentially the most cost-effective solution.